Hello, everyone. Thank you for joining us for today's updates from the Long-Term Care Inspections Branch. This event is co-hosted by Family Councils Ontario and the Ministry of Long-Term Care. My name is Taeyong Jung. I am the Event and Project Manager at FCO. Before we start, I would like to take a moment to recognize the land on which we are gathered today. We are meeting on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, is now home to many diverse First Nations, Inuit, and Métis people. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. We wanted to share a few logistics and housekeeping rules before we turn things over to a presenter. First, you'll notice that all participants are in listen-only mode. We have reserved time today at the end for an interactive question and answer period. At that time, we invite you to use the Q&A box to ask your questions to the ministry. You can also use the chat feature if you are experiencing any technical difficulties or if you have any questions about logistics. And for your information, today's session will be recorded and will be made available to participants on Family Council Ontario's website and YouTube channel following the presentation. Now it's my pleasure to turn it over to today's speaker, Brad Robinson, Director of the Ministry of Long-Term Care's Inspections Branch.
Great, thank you. Good afternoon, everyone. So I'm going to be walking through a bit of a presentation via slide deck for today's show. And then at the end, we will provide an opportunity for some questions and responses. And there were some questions that were submitted prior to today's meeting, which we will respond to towards the end as well. So I'm going to share my screen. And can you just confirm that you can see the slide?
Yes, perfect.
Yep.
Perfect, thank you. All right, so what to expect today? So we're going to talk a little bit about the inspections program and the inspections branch with the Ministry of Long-Term Care. We're going to review our proactive compliance inspections. We're going to talk a bit about investigations, CARES, which is our digital platform that we utilize for the purposes of completing the inspection. We're going to talk about residents and family councils, and we're going to talk about how we perform as a modern regulator. So we'll kick us off with a bit about the inspections branch. So as you know, the inspections branch is a branch within the operations division of the Ministry of Long-Term Care. Our minister is Natalia Kuzendova-Bashta. She's supported by our Deputy Minister, Melissa Thompson. And then there's 4 divisions actually within our ministry. So there's operations, capital development, system planning and partnerships, and policy. And so the inspection branch falls under the operations division, and that is led by our Assistant Deputy Minister, Kelly McCaslin. Within the operations, there are 4 branches. So there's the funding and programs branch, the operational policy and implementation branch, the performance and operational issues branch, and then the inspections branch. And so today, as I mentioned, we're going to just focus on the inspections branch. The inspections branch is spread out across the province. So we do have 7 district offices and a number of satellite offices. So our district offices are located in London, Ottawa, Hamilton, Toronto, Central East, Central West, and the North. And then, as I mentioned, we do have satellite offices that are arm's length from the districts. We also have a number of support functions within our branch, and those fall under individualized units, and those support the inspectors, and that's through issues management, IT system management. We also have policy area that focuses on third-party responses. So those are any of the recent Auditor General or Ombudsman reports that you may be familiar with. There's strategic planning, operational policy, quality assurance, data and data analysis, We also have an intensive training program, and then we also have an appeals program. So about inspectors, so obviously the primary role of an inspector is to determine compliance with the Act and the regulations. As I mentioned, inspectors undergo an extensive training and job shadowing program prior to becoming certified. And that process takes approximately 9 months from the time that an inspector is hired and onboarded with the ministry. In order to be an inspector, you have to be a regulated healthcare professional, and you have to fall under the designation of either a registered nurse, a registered dietitian, a registered physiotherapist, a social worker, occupational therapist, or a speech language pathologist. So inspectors have a number of responsibilities. First and foremost, upholding the Act, and that's ensuring compliance with the Fixing Long-Term Care Homes Act. There's an important part with quality assurance, and that's upholding the standards to ensure that high level of quality care is delivered within the sector. There's safety and oversight, advocating resident well-being. So that's ensuring residents' rights are respected and homes are operating as a resident's true home, and that they're prioritizing safety and quality of life. We also ensure that we're building public confidence and that we maintain public confidence. Always continuous improvement, and that's driving ongoing enhancements to our program, public interface, and transparency. So all of our inspections that an inspector conducts are unannounced. And so we do that purposely, and that's just to ensure that when inspectors enter, that we're entering the home in a true kind of state, so that the home doesn't have time to prepare for us to enter. And inspections can last anywhere from 1 day up to 2 weeks, depending on what the individual inspector or inspectors are looking for, and how many intakes that they're taking. And an intake can either be received through a complaint process or through a critical incident that the long-term care would have submitted to the ministry. So upon arrival, inspectors meet with the administrator or their delegate and explain the purpose of their visit. They will ask to see certain documents, and they will request access to their IT system. And that provides them then access to resident records and any pertinent information that they may require in order to complete their inspection. Throughout the inspection, they'll also review documents. They'll conduct interviews with staff and residents. They will also perform an exit debrief. So once the inspection is completed, they will meet with the team and review the findings that they've uncovered through the inspection. And then a report is written and shared with the home. And so there's two versions of the report. One is a licensee version, and that is a much more detailed report that does contain PHI. And then there's a publicly posted version with all of the personal health information removed. So I mentioned there's a number of inspection types that we conduct. And so they fall under kind of 3 categories. So we have reactive inspections, proactive inspections, and then we also conduct what's known as a pre-occupancy review and the post-occupancy inspection. So I'll break those down a little bit for you. Within the reactive inspections, there's 3 types. So it can be either through a complaint that we've received, it could be through a critical incident, and those are mandatory reports that the licensees have to make to the director, or a follow-up inspection, and that's to follow up on a previously issued non-compliance. And then we have a proactive inspection regime, and these are really broad-based inspections that are carried out on a regular basis to ensure that the home is in compliance. And then the last component is the pre-occupancy and post-occupancy. And so these are conducted when a new licensee opens a home. We go in and we conduct a pre-occupancy review to ensure that the the home is ready to admit residents and that they're within the Act and the regulations. And then we grant the licenses. And then after the residents have been admitted to the home, we complete a post-occupancy inspection. There's also information at the bottom of this slide specific to how individuals can make complaints. And so anyone can make a complaint or an inquiry to the Ministry of Long-Term Care through the Long-Term Care Family Support and Action Line. And this number is fairly readily available, and it should be posted in all long-term care homes as well. So the inspection process, so there's a number of steps that actually occur within an inspection. So I'll just walk you through kind of the high-level overview. So the ministry receives either a complaint or a critical incident, and then a triage inspector will review that information and make a determination if an inspection is required. The inspector will then contact the complainant if applicable, and then they create what's called an inspection plan. Then they enter the home, and at the home, the inspector will conduct some observations. They will complete some interviews, and they will complete a thorough record review. The inspection guides throughout the inspection to determine compliance. And then post-inspection, they complete an exit debrief. They will write their reports and serve the reports, and then they will publicize the public version of that report. So some inspection statistics, and these are based on 2023. So the 5 top compliance orders that were issued in 2023 were around plan of care, infection prevention and control, duty to protect, transferring and positioning techniques, and skin and wound. So how did we determine those 5 top compliance orders? Well, we completed a little over 1,800 inspections. We issued 80 issues reported. So sorry, these were issues that were reported and inspected on, were 8,369. And so the discrepancy between an inspection and the issues reported is when an inspector it completes an inspection in a home, they could be looking at a number of different intakes upon that inspection. And so within an inspection report, they may have looked at several different intakes. We refer to them as intakes per inspection. And so even though there's only one inspection report, several items may be looked at in each inspection. And then a total non-compliances issued were 7,168. Because we use an escalated compliance and enforcement regime, items can be escalated to the director for additional follow-up. And I have powers under the Act and the regulation to issue my own orders, or I can direct a home to do a certain thing. And so in 2023, I, as the director, issued 3 ceases of admissions to different homes across the province. There were no orders requiring management, and so a total orders served were 3, and that refers back to the ceases of admission. So our proactive compliance inspection regime. So this is an inspection regime that was introduced just post-pandemic, well, kind of during the pandemic. We had a proactive inspection regime up until 2018, and it was paused. And the reason it was paused was to work and develop a new enhanced regime. And then the pandemic came upon us, and so we continued that work, and we set out some new proactive compliance inspection targets. And so what a proactive inspection does, a little bit different from our reactive inspections, is we're looking at a broad band of different pieces of legislation in an inspection. So they're not focused on a complaint or they're not focused on a critical incident, but they're looking at pieces of the legislation that the long-term care home needs to have in place. And so our focus on a proactive inspection is really around a few key pieces. So infection prevention and control, abuse and neglect, safe medication management, nutrition and hydration, policies and directives, dining observations, resident rights, and plan of care. And so those are the high focuses that we do during a proactive compliance inspection. And so we have until 2025 to complete one proactive inspection in every long-term care home in the province. And then it'll be every year thereafter. And so as of March 2024, over 50% of Ontario long-term care homes have received a proactive compliance inspection. Out of our proactive compliance inspections, we've identified what are the top 10 non-compliances that we've identified. And so you can see the list on the screen. So plan of care is ranked at the top. Infection prevention and control, continuous quality improvement, continuous quality improvement committee, posting of information, resident and family caregiver experience survey, dining and snack service, doors in a home, orientation, and windows. So we completed 157 PCIs in 2023, and so far in 2024, we have completed 198 PCIs. So investigations. So back in coming out of the pandemic, it was recommended that we initiate an investigations unit as part of our branch. And so part of that was to ensure that those homes that were frequently in non-compliance or had had committed offenses under the Act had an avenue for us to be able to investigate upon those. And so in 2023, in fall of 2023, we launched our investigations unit. And so there's 11 offenses, provincial offenses within the Act that can be investigated. And so those are listed. So there's duty to protect, reporting false information to a director, failure to report to the director, attempts to suppress reports, whistleblowing protection, obstruction, director's duties to comply, operating without license or outside the authority of a license, obstruction of inspector, failure to comply with an order, or false labeling of a home. So what's the difference between an inspector and an investigator? So an inspector determines compliance with a statute or regulation. So they identify and address contraventions of the Act and regulation. Where contraventions are found, they will issue reports and compliance orders. Inspectors can compel the production of documents, records, and information, and inspectors can make referrals to our investigation team. An investigator collects and evaluates evidence of non-compliance with a view to prosecution. So they identify and gather evidence to determine if offenses under the FLTCA, which is the Fixing Long-Term Care Act, have been committed. Investigators create reports, crown briefs, they can lay charges, and issue summonses where appropriate. It should also be noted that residents, long-term care home staff, or licensees cannot call for an investigation to be done. So we have an internal referral process. Details are kept strictly confidential at all stages of an investigation and evidence gathering. And while their duties are separate and distinct, inspectors and investigators have been trained on their respective programs and processes. And as I mentioned, inspectors can make referrals to our investigations team. So we'll talk a little bit about CARES, which is our IT system. So CARES, which stands for the Compliance Assistance and Regulatory Enforcement System, is a custom-built IT solution that is used by inspectors and ministry staff. CARES was first implemented in September of 2022 and continues to undergo ongoing development. And so this is part of a broader effort to modernize the way we carry out our inspections. The third phase, which we are in now, is a outward-facing phase. And so one of the key changes in phase 3 that will impact long-term care homes is the development of a new critical incident software system. And two other notable phase 3 developments is new Service Ontario Infoline software and new communication portal on longtermcarehomes.net. And so you may wonder what Service Ontario has to do with this, but all of our monitoring and calls that come in after hours to the action and support line are actually go through Service Ontario. So residents and family councils. So residents and family councils are highly functioning key contributors to positive outcomes for residents. The Fixing Long-Term Care Act requires every home to establish a residents' council made up only of residents of the long-term care home. And under the FLCTA, every long-term care home may have a family council. Typically, a family member of a resident or a person of importance to a resident is a member of the family council. So during a complaint or critical incident inspection, inspectors will speak with a resident council member if there is a connection between the complaint, critical incident, and the resident council. And during a proactive inspection, inspectors speak with the resident council president, review notes from previous council meetings, and verify that the home is responding in writing within 10 days to the council's concerns. During a proactive inspection, inspectors speak with the family council president and review the meeting minutes from the last 3 meetings. Inspectors are seeking to determine if the council's concerns are being addressed by the home. So it's an important step to ensure that your voices are being heard and that the outcomes are being addressed. So the modern regulator. So as inspectors, we follow the modern regulator code of conduct, and we maintain alignment with all the regulators within the province, and so we are consistent in our approach. So if we look at kind of inspections trajectory over the last 15 years, some of you may remember or recall that back in previous to July of 2010, we had what was known as compliance advisors. And then the Act and the regulations, the Long-Term Care Home Act came out, and that's when the inspectors replaced the compliance advisors. Then coming out of the pandemic, there were several adjustments and considerations that were given to our program and how we do our work. And then in September 2021, our first proactive compliance inspection was conducted. In 2022, April 2022, the new Act and regulations were proclaimed. In September of 2022, we had our new CARES software launched. In November of 2023, our investigations program was launched. And then moving into this year and moving into next year, we're going to be looking to take a focus on compliance assistance and how our program can better provide support and assistance to the sector. So a few different ways that we're going to be looking to do that. So we're going to be offering a series of webinars to the long-term care sector, just with a focus on a few different components, mainly around the Act and the regulations, around what to inspect when inspectors come into the home, and then we're going to continue to require or request what the sector feels that they would like us to provide some additional education and support on. We're going to be ensuring that we have transparent communication methods during the inspection as well as upon exit. And that's just ensuring that the sector and that the licensee and the staff of the home are aware of what the inspector are finding when they're completing an inspection, and ensuring that there's a clear understanding at the end of the inspection what the inspector is requesting the licensee to do. We're going to also here, but we're rolling out a lean pilot. So right now, some homes in the Ottawa district have been experiencing the lean pilot, and it's a bit of a streamlined approach and consistent approach in all long-term care homes. And one of the goals is to expedite the delivery of the inspection report to the licensee on exit of the home, on exit of the inspection. And that's important so that the licensees have an opportunity to act quickly on any of the non-compliances that were identified throughout the inspection. I won't go into too much detail on this. This is just the compliance continuum. And so obviously the biggest part of our job is really about education, outreaching, promoting compliance. And then as the pyramid gets smaller, the activities move up the scale. So compliance checking, inspection monitoring, that's part of our assuring compliance. For improving voluntary action plans, preventative corrective orders, and penalties. And then the enforce is the tiny part at the top. And that's where our investigations team comes in. And so there's not, a lot of our 620 homes that require significant enforcement. But unfortunately, there are some that fall in that category. And so our commitment, so sector engagement to understand perspectives on current state and identify opportunities for improvement, continued discussions with inspection staff through district meetings to understand perspectives and identify opportunities for improvement, and continue with our both internal quality improvement processes, but also ensuring that we're engaging with our sector partners. We also work very closely with OLTCA and Advantage Ontario. We meet regularly with them just to ensure that any opportunities for improvement are highlighted, and just to ensure that there's some consistency across the sector. As I mentioned, there's a couple of ways to contact us. And so we can, through visiting ontario.ca, inspection feedback, or calling our business information line, which that information is on this slide. And then also, again, complaints can be made by anyone to the Ministry of Long-Term Care directly through our Long-Term Care Family Support and Action Line. And that's toll-free from 8:30 a.m. to 7 p.m. daily. So that's the end of the presentation. I think we can open it up to some questions. And I know that there were some questions that were received prior to the meeting. So I'll maybe hand it over to Tammy Simonowski, who's one of our senior managers within the inspections branch. And she's going to respond to the questions that were provided prior to today's meeting.
Yeah, Brad, wondering if you can stop sharing your screen. I'm just gonna, one of the questions was just some clarification about how to look up sections of the legislation when homes are receiving non-compliance. So I'm just gonna share my screen really quickly. If I can do that. Second here. Okay, so let me know if you can see that.
Yeah, we can see that.
Okay, Great. So on the screen, so there's two sections you may see. In the report, you will see it'll either say Fixing Long-Term Care Act, so FLTCA 2021, and that will indicate that the piece of legislation is issued under the act itself. If you also see this area here where it talks about O.Reg 246/22 general, that means it's actually issued under the regulation. So when you go to look up on your on the Ontario website search laws, you would look under the regulation, and as you scroll down, you will see here the contents. It will have listings of each number. So for example, I think in the question asked, it said a non-compliance with regulation, section 268. So if I scroll down all the way to number 268, so bear with me here. You can click on the number and that will take you directly to that section. So here you will see the number here that's bolded. That is the section. And then these numbers here in brackets, we refer to as subsections. So in the non-compliance, for example, in the question, it said section 268, subsection 4. So I would go down to 4 in brackets. And then the non-compliance, because under this section, it has numbers here further, 1, 2, and it goes all the way down, I think, to 16. In this particular example, it said 4 and then 1. So I would look under 1. So the area of non-compliance was that the licensee shall ensure that emergency plans provide for the following: dealing with emergencies included without limited to, and then it would further break it down. And in this one, it was 4. So then you would look to violent outbursts. So that would be this section. So as the non-compliance are issued, you just follow along with the subsections. There may be sections where it's just the piece of legislation itself, and then you wouldn't have to have all of those numbers behind. But if they identify all these numbers behind, then you just go in sequential order of where that would be. So hopefully that helps a little bit. It is a bit confusing if you haven't used it before, but hopefully that will help. And then the Fixing Long-Term Care Home Act is set up the exact same way. You can just click on the number. For example, you can just click on the number. Again, the bolded section is the section in which is identified, and then whatever's in brackets would be your subsection. And here's an example of where there's just one subsection for this particular piece of legislation. So hopefully that answers that question. I think the second question, when would the inspector reach out to family council member for their input? I think Brad mentioned that earlier. So in a proactive inspection, they would reach out to the family council president, in which, again, as Brad mentioned, we're just looking to make sure that there's appropriate follow-up to the concerns brought forward from family council to the homes. If an inspector does reach out to family council in relation to a complaint or critical incident, they may reach out to someone. It would be just to gather information based on the specifics of what the inspector was inspecting at the time. And then the last question I think we got was, when a written notification or any other order of noncompliance is issued to the facility, when and how does the ministry follow up to ensure compliance? So any compliance order that is issued by an inspector is followed up upon. So a follow-up inspection will occur to make sure that the home complied with the order. So whatever the inspector has asked the home to do, a follow-up inspection will occur to make sure that they have done that and corrected the issue. Written notifications that are issued to homes, there are no follow-ups to written notifications. However, in saying that, when an inspector goes back to a home to do an inspection, and if the same issue is identified under the same piece of legislation, the home would be issued non-compliance based on that same piece of legislation. And that when a home builds up a history of that same piece of legislation and being non-compliant with that, it has the potential to escalate to an order in future inspections. I'm not sure if Al, you wanted to add anything in relation to those questions, but I think those are the questions we had at this point in time.
Well, I think you've captured it well. Thanks, Tammy.
So I
Okay,
think there might be some Q&As I see here. So the first question was, what training do inspectors receive? Content in hours, etc. So our inspectors go through quite a lengthy training process. Usually it lasts from approximately 9 to 11 months for them to go through the training. And they're all required to pass a certification before they can go out on their own and inspect. It involves some classroom work, it involves shadowing, and then it also requires them to be tested on the knowledge and comprehension of that learning.
So Tammy, maybe I'll just pick up the next question, which is
Perfect.
asking about the criteria for critical incident reporting. So I will just say this, that the regulations are very prescriptive with regards to reporting. And they're broad. So there's a whole host of things that need to be reported to the director. So if the home becomes aware of abuse or suspecting abuse or receive an allegation, they need to report that to the director. With regards to critical incidents, so loss of power in the home or systems in the home for kind of sustaining systems, things like falls with regards to residents being sent to the hospital or significant change in condition. There are incidents where loss of water, critical incidents involving an outbreak in the home. So I could go on and on and on. It's very, very extensive. There's a significant reporting requirement for long-term care homes to report to the director things that are happening within the home. And all of those critical incidents that we receive are appraised by triage inspectors at our branch here, who assess the information and determine whether or not some further action, inspection action, or inquiry needs to take place. But I could go on for probably 20 minutes explaining all the kind of different places where the homes are required to report. But for the purposes of the question, I think if I was to kind of zero in on some of the most important things that we see reporting on, there's certainly outbreaks in the home, loss of systems in the home, and of course, anything related to allegations of resident neglect or abuse. And then I think I'll just pass it over to Chris, because Chris, there's a question about investigations.
Thanks. Good morning. I'm Chris Monconfuso. I'm the senior manager in charge of the investigations unit. The short answer to the question, have any investigations occurred to date, is yes. But actually, what I will say is we've had multiple instances referred over to our teams. There are a number of investigations that are ongoing in homes across the province, and we have a few investigations that have been investigated and closed at this time. Unfortunately, I'm not going to be able to share any details.
Thanks, Chris.
Thanks, Chris. The next question, my understanding is that inspection interviews are all recorded. This is very intimidating. So all of our inspection interviews are recorded. And the purpose of recording it is to increase the accuracy of the information that the inspector is collecting, as well as make it more efficient. This is an area in which we continue to work with our inspectors on in terms of approach during interviews. But it also allows us from a quality assurance perspective to also have a look, because when we listen, when we're looking at inspections that have been completed, we're able to listen directly to the interviews that occurred. So there's been a lot of positive outcome from recording them directly, but can appreciate for the person that is being interviewed. It's obviously not something that they occur every day, and may be a little bit of uncomfortable, but it is something we are working with our inspectors on to kind of let's say realign so that people are more comfortable with the approach with our inspectors. Not sure if anybody else has anything they want to add to that.
No, thanks, Jamie.
Okay. The next question, are the inspection guides available to caregivers? Al, I'm not sure if you want to, can you jump in on that one?
So currently the inspection guides are available to long-term care homes through longtermcarehomes.net. So that's a closed system. I'd have to kind of review to see whether or not they've been disseminated publicly. I don't believe that they have. And what you should understand about the inspection protocols or inspection guides is they're quite broad and wide-ranging, purposefully so. We want inspectors to really discover the story of what happened rather than focus in on specific questions that we might imagine from a scenario. So I don't believe that they're kind of widely publicly available. So I think that's the answer. Yeah, I think that's it.
Thanks, Al.
I'll take the next one. So can the inspections branch look to embed the link to this section of legislation right in the inspection report? So we can definitely take that back. So our, as I mentioned, I talked a little bit about our lean pilot project that's rolling out across the province. And so we're always looking for opportunities to improve and make our processes and our reports for the public easier to understand. So it is something that I can take back. I can't commit to it, but I can take it back for further discussion.
Thanks, Brad. The next question, is the Family Council President contacted at each proactive inspection? So as Brad mentioned, each of the proactive inspections, the Family Council President should be contacted to complete that portion of the inspection.
And just maybe I'll pick up the next question. I'm wondering why there's only one written notification given initially at the time of inspection if an incident had occurred numerous times. So just to explain this out. So the inspector is held by the regulation to kind of consider three things under the act when they're issuing a sanction. So they're required to consider the compliance history of the home. So how many times has this happened specific to that regulation? The impact on the resident. So was the resident harmed or not harmed, or was there no kind of harm to the resident at all? And then how widespread, or what was the scope of the issues? So those are the three things that inspectors consider in whether or not they're going to issue a written notification or a compliance order or something more. They're held to kind of consider only those three things. And so it's true that it's very possible that a written notification might have been issued, and on a second finding of noncompliance, yet another written notification could be issued depending on the severity and the scope of the circumstance. So that's the inspectors use a kind of a very rigid tool, noncompliance decision tool, to determine their sanctions. And so they're kind of held to that noncompliance decision tool. That framework kind of sets out so that we're working fairly across the province with each licensee.
So
I think the a couple other questions with regards to, so follow-up inspections. Yes, there's a follow-up report issued for every inspection that we complete. So with follow-up inspections, there would be a report that would be issued. I think we answered the question around our interviews recorded. And then I will hand the next question over to Chris in relation to the investigations unit.
Yeah, thanks. There's two paths. When an investigation comes to my unit, there's two paths that it can go on. An investigation will take place, and we determine that there are no offenses that have been committed, and then there is an internal report generated. It's reported up through me and then to the director. So those reports do remain confidential because there's been a finding that there was no offense that had been committed. When there is a determination that an offense may have been committed, then those reports are passed to a Crown prosecutor, and we consider, or we in with the Crown prosecutor determine whether or not charges should be laid under the Fixing Long-Term Care Act. Once charges are laid, information does become public as part of the court process, but generally the actual contents of that report are left confidential and closed until after a court proceeding is done. There is nothing that is generated and put up on longtermcarehome.net under a home's profile with respect to investigations. I will say that all investigations that are closed are accessible through Freedom of Information.
Thanks, Bruce.
Okay, so the next question, if a resident is sent to a hospital because of care handled incorrectly at a long-term care home, is that sent by the hospital or emergency doctor to inspectors, or is that up to the family members to send an inquiry about? So there are occasions in which hospital physicians will reach out through the action line to share information. What I would say is that if a family member is concerned at any time, that they should also reach out to the family support line as well. Just to ensure that we have received their inquiry in case the family or in case the hospital physician has not shared anything forward.
And I'll just add to that, Tammy. Inspectors have unfettered access to anything in relation to the operation of long-term care homes. So if they received information about a resident who was sent to hospital, but the licensee had not provided that information, they have it within their right to speak to anyone at the hospital and to collect information about the care of the resident if the hospital has it in hand. So it's just an important nuance that the powers of the inspector are quite significant in terms of getting information from the home and from the licensee and from other entities who are kind of operating around long-term care homes.
Thanks, Al. An example of an administrative penalty. So generally, for our AMPs, so if a compliance order has been issued, we go in to do a follow-up inspection and the order has not been complied. We can issue a written notification with the AMP attached, and there's a guide in the regulations that set out the amount of the AMP based on the non-compliance that was issued. So there's that it might occur that way. The other way it might occur is if we've gone into the home, we plan on issuing a compliance order related to a specific piece of legislation. And we look at the compliance history, and the home has had a previous compliance order under that same piece of legislation, and although they may have complied the order when we did the follow-up, there is still that history. It may trigger a AMP as well. And again, the inspector will use that guide set out in the regulations in terms of the amount that it will be. So there is a chart that will lay out what sections of the regulations that an AMP could be issued under. So hopefully that answers that question. Not sure if anybody else wants to add anything further to that one. No?
No, nothing
Okay.
else. I think the next question, so the follow-up part 2 follow-up inspection question is the to family council and posted for public view. So yes, all of our inspection reports are publicly posted and should be provided to the necessary people within the long-term care home. So the types of reports are complaint inspections, follow-up inspections, critical incident inspections, proactive inspections, as well as post-occupancy inspections. So those are the reports that would be, or if the director issues an order through a director's order report. The next question, is there one inspector per 2 long-term care homes? Are there over 300 inspectors then? And if so, presumably they are not all full-time. So we do have 1 inspector for every 2 long-term care homes in the province. So we exceed out of all provinces in Canada for that ratio. So we have 344 inspectors, and they are all permanent full-time. And that's it for our questions.
Maybe I'll just make a comment, Brad, about the inspection reports. So I think it's important to understand that an inspection report is a document that contains many inspections. And so one inspection report might contain the inspection of many items. So within each inspection report, there could be up to 10 inspections taking place. The narrative of the outcome all appears in one report, but the kind of the work done by the inspectorate is really kind of more broad ranging than just counting the number of inspection reports. So it's an interesting kind of nuance to the work that we do. Thanks.
Thanks, Al. And maybe I'll hand it back over to you, Ty.
Great. So if there are more questions, you're welcome to email me and I will pass the questions along to the ministry. But thank you everybody for being so engaging today. Thank you, Brad, Tammy, Alan, and Christopher for the presentation. And also as a reminder, this webinar has been recorded, so it will be available on our YouTube channel probably next week. And yes, thank you all. We also have another webinar with the ministry next week for those who are interested. It's on fall respiratory illness season preparedness on Thursday, October 10th at 10 a.m. The information will be sent tomorrow in our weekly bulletin. And the registration link will be there as well. So thank you all for being present today. And I hope to see you next time and have a great day. Thank you very much.
Thanks for having us.
Thank you.
Thank you. Goodbye.